toe assessment, is that okay? Okay, I'm going to perform hand hygiene before I touch you. Okay, can I go ahead and see your wristband, please? Can you go ahead and tell me your name and your date of birth for me?
Mackenzie Feeney, January 11, 2000.
Okay, perfect. Everything I assess anteriorly will be assessed posteriorly, and everything on the left and right will be assessed like bilaterally. Just disclaimer. Okay, so I'm looking at Mackenzie. She has a neutral expression. Her hair is distributed equally, and it's appropriate for her gender and her age. Her eyebrows are symmetrical. Her eyelashes are pointing outwards. Her eyes, there's no ptosis. Her eyes are opening spontaneously, as well as her ears being intact and they're symmetrical. And same with her nose. I will say, if I can just look into your eye really quickly, her conjunctiva is pink and her sclera is white. And if I go from the outside, her cornea is smooth and clear, there's no opacities, and her iris is round and symmetrical on both sides. And yes, so, sorry, I'm thinking, let me look at your nose. There, her nares are patent, and her nose is symmetrical. Her mouth, her lips are pink. If I can go ahead and look into your mouth, please. Say ah. Her uvula rises with phonation. Her teeth are white, symmetrical, like no spaces, just good dentition overall. Her mucosa is pink, light and moist. Her tongue is pink. Oh, also her skin tone is appropriate for her ethnicity as a whole. Okay, I'm going to now palpate your skull. Don't feel anything, any like tenderness or pain. I'm going to go ahead and palpate your ears, any tenderness. I don't see any redness either. And I'm going to palpate your sinuses, frontal, maxillary. Any tenderness? No. Okay, good. I'm now going to palpate your thyroid and your lymph nodes. So I'm going to go with your lymph nodes first. I'm going to start with the preauricular, the postauricular, the occipital, the tonsillar, the submandibular, the submental, the superficial cervical, the deep cervical chain, and then the supraclavicular. And they were not palpable, but if they were, they should be smooth and like not enlarged. And I am going to, you can face this way so I can do palpate your thyroid. Okay, not palpable. Everything seems to be good there, smooth. Also, her trachea is midline, throat symmetrical, everything is good there. I'm now going to test her cranial nerves. So for cranial nerve 1, that would be the olfactory one, so she would include one nostril, smelling, and like coffee, vanilla, anything like that. But we are going to move on to cranial nerve 2, being the optic nerve, and that was assessed with the Snellen chart, and she got 20/20 vision in each eye. And then I'm going to, where did my pen light go? Oh. If you could just look at this pen light, like right there at the 6. I'm going to bring it closer. Okay. That's the confrontation test. Her visual, like her pupils dilated as the object got closer. I mean constricted, I'm so sorry, I misspoke. Yes, and they got closer together. And I am going, yes, okay. So now for cranial nerves 3, 4, and 6, We're going to do the perla and the peripheral. Okay, I'm going to, if I can just, okay. Okay, the pupils are eagle, round, and reactive to light. Now, if I can just have you sit like this, facing
this
this
way?
way. Tell me when you see my.
I said no.
You said, yeah, I thought I heard you.
It was just
Peripheral
quiet.
vision. Peripheral vision is intact. Cranial nerve 5, the trigeminal one. We are going that sensation, so we're going to test her face sensations with the cotton ball. So if you could just close your eyes for me. Here.
Cheek.
Oh yes. Please tell me what you feel. Sorry.
Forehead.
And then the
Cheek. Chin. Cheek.
Okay, awesome. So cranial nerve 5 is intact. Cranial nerve 7 is the facial one. So if you can go ahead and smile for me, please. Frown, puff your cheeks, raise your eyebrows, lower them. Good. Okay, cranial nerve 7 is intact. Cranial nerve 8, sorry to move you again, but if you could just go this way. I'm going to plug one of your ears, and I'm going to whisper, and you just repeat what I whisper. Sorry. I'm so sorry. Okay, together.
I'm sorry. What? K. L.
Okay, good job.
T. 7. 8.
Good job. Our hearing's good. Cranial nerve 8 is intact. When I looked into her mouth, with her cranial nerve 9 and 10, I'm going to verbalize this because I don't have a tongue blade, but her gag reflex is normal. Her uvula did rise with phonation, so cranial nerve 9 and 10 were assessed through that. If you could sit up for me, I'm going to go ahead and test cranial nerve 11. So just, can you shrug your shoulders? Good. And can you turn your head towards where my hand is? Good job. Good job. Cranial nerve 11 is intact. Cranial nerve 12, if you could just stick out your tongue for me. The tongue protrusion is at the midline. So cranial nerve 12 is intact. Okay. Now I'm going to go on to the respiratory system. So I'm going to inspect her thoracic area. There's symmetrical, there's no palar cyanosis. There's no labored breathing, like no use of accessory muscles to help her breathe. Yes, so everything looks good there. I am then going to palpate. So if you could just turn for me, please.
You may turn like this way.
Yeah, perfect. Okay. Okay. Everything feels good. Any tenderness or anything? If you could go ahead and stand up for me, I'm going to have you just take a deep breath. Okay, one more. Okay, that's symmetrical. Her expansion is symmetrical. I'm going to test her here. Any pain?
No.
Any pain?
No.
Okay, CVA, tenderness test, everything's good, normal. I'm now going to auscultate her lung sounds. everything sounded normal. No adventitious sounds like wheezing or any of that. So, good job. I'm going to now move on to her cardiovascular area. I am inspecting her precordium. There's no visible pulsations, no heaves. I am going to, I just blinked out. I think I'm just going to, I'm gonna do your pulses now. Okay, so this is radial, brachial, and I can just have you scooch forward. Her femoral would be like right in there, and then the popliteal behind the knee, the dorsal pedis, and the posterior, on the inside, yeah, posterior tibial. And all the pulses should be 2+ bilaterally. I'm going to auscultate your carotid arteries for any bruits, sorry. And you would do that with the bell. Okay. No bruits present. I don't know why I did this, but I'm gonna auscultate I'm gonna start with the aortic, using and then pulmonic, Erb's point, tricuspid, and the mitral. Sorry. And this is where the point of maximal impulse is, so you would listen to that for a minute. And then I would go back up with the bell on each mitral, tricuspid, Erb's, pulmonic, aortic, to listen for any extra sounds or murmurs. Okay. Yeah. So now I'm going to ask you to lay down in a supine position with your knees bent, and have you peed? Are you on an empty bladder?
Yeah.
Perfect. And I'm inspecting her abdomen. Her abdomen is symmetrical, the contour is smooth, there's no wounds, scars, tubes, drains, ostomies, lesions, masses, anything crazy. Everything's normal. I'm then going to auscultate first. Starting with her right lower quadrant. Moving up and over. Okay, her vowel sound sounded normal, active. And now I am going to percuss. Starting with her right lower quadrant again. Okay, and now it's supposed to sound tympanic over the hollow organs and dull around the liver border. And now I'm going to palpate, starting with the right lower quadrant again. Light palpation first. How's that feel?
Good.
Okay, now I'm going to follow the deeper palpation. Everything okay? You feel good?
Mm-hmm.
Okay, everything seems good there. And now if you could stand up for me. I'm assessing her musculoskeletal system. Hair distribution, everything's equal, everything's symmetric, no masses, no edema. If you can just go ahead and grip my two hands, squeeze for me. Okay, equal strength on both right and left hands. If you could take a seat for me, please. I'm going to, if you can just push, okay, push, okay. Equal strength on both right and left feet. I'm going to check for your skin trigger. Okay, there's no tenting. Can I see your finger for capillary refill? Okay, less than 2 seconds, perfect. I am thinking. Okay. I think I'm good.